All right, perfect. Thank you all for joining us. Sorry about these technical difficulties. I didn't realize we were running this as a webinar. So you guys, we don't see you, but you're here. And I'm going to jump into our platform because we have 30 minutes today. So I'm going to share my screen. Send me some thumbs up. Let me know you can see this. Let's see. Perfect. Anybody? Thumbs up. Oh, I don't like this webinar setup. Okay, somebody, let's see. Raise a hand. Okay. All righty. I'm going to assume that you guys can see this.
Wendy and Rudy are with us, so that's good.
Okay, and Wendy. There we go. All righty. All right, so welcome and thank you for joining us for our policy platform webinar. Today, we will be talking about increasing tobacco cessation services in tribal communities. And we have some invited guests that we will be sharing our space with today, because the best way that we can share what is going on in tribal communities is allowing our tribal partners to talk on their own behalf and to share their successes. So TCCC, we are fully staffed. I'm the project director, Nazba Ben. We have Ravina Soto, our project coordinator, Samuel Black, our tribal engagement and outreach coordinator, Treble Vasquez, our media specialist, who's joining us today, Tatiana Masters, who is our evaluator, and we just added Jacqueline Peters as our program assistant. It says evaluator there. Okay, so just jumping right into things from our update. Nationally and in California, American Indians and Alaska Native communities have disproportionately higher rates of commercial tobacco use and exposure to secondhand smoke. In California, American Indian and Alaska Native adults had the highest rates of cigarette smoking rates, which is 19.1%, and flavored e-cigarette use, which is at 18.4% compared to other racial and ethnic groups. American Indian and Alaska Native people compared to other racial and ethnic groups have a higher risk of death and disease caused by commercial tobacco products. We experience a disproportionate number of consequences from smoking, including asthma, heart disease, lung cancer, and chronic obstructive pulmonary disease. For example, the California American Indian Alaska Native community has consistently had the highest asthma rate of any racial or ethnic group at 14.3%, while decreasing in California's general population. Cardiovascular disease and lung cancer are among the leading cause of death for American Indian and Alaska Natives. The incident rate for lung cancer among American Indian and Alaska Native adults aged 35 and over increased from 77 per 100,000 in 1988 to 113 per 100,000 in 2013. California American Indian and Alaska Native adults age 45 and older have a mortality rate of 128 per 10,000, where chronic obstructive pulmonary disease was listed as the underlying cause, which is the highest of all racial and ethnic groups as well. While intentions to quit remain high at 88.4%, American Indian and Alaska Native adults struggle to quit with their smoking behaviors. Barriers, including challenges with culturally relevant tools and services, are made more complex by the relationship with historical trauma, which leads to other forms of substance abuse, disproportionately high rates of depression and other mental health disorders, high levels of poverty and unemployment, and lower rates of academic achievement. So we cannot create policy change in tribal communities without addressing historical trauma and the lasting effects on the community structure. We acknowledge California tribes and tribal partners must take the lead on this work, who are able to elevate Native ideologies and practices in the communities that they serve. Tobacco control work is more effective when when it provides them an avenue to simultaneously teach about the dangers of commercial tobacco use while also reclaiming their cultural practices and honoring traditional tobacco. By working with culturally relevant and appropriate processes, we increase the success rate of American Indian and Alaska Native quit attempts. Okay. Tribal cessation practices that are being implemented by our tribal partners include increasing community education and awareness of commercial tobacco's impact on our communities, and improving cessation protocols such as Ask, Advise, Refer, or Ask, Advise, Assess, Assist, Arrange, in collaboration with tribal health clinics, including referral information for medical, dental, behavioral, and social services staff. Our tribal partners are also expanding their use of social media campaign, education material development, and digital storytelling to create culturally relevant and appropriate ways of reaching the communities, while also continuing to refer patients and community members to Kick It California resources to help tribal members quit smoking. All along the way, all of our tribal partners have differentiated between the use of traditional and commercial tobacco. In this differentiation, the main difference is that traditional tobacco use is more focused on the process of tending, gathering, and using the tobacco plants in a respectful manner that is in accordance with the tribal guidance, as opposed to the commercial tobacco that is more focused on the product and the profit-driven use of tobacco. Okay. We have 5 tribal projects and tribal serving projects that are working on tobacco cessation in their communities. We've got Native Star Red Medicine Tobacco Prevention Project, who is working to include processes to systemically refer patients and clients to accessible evidence-based tobacco cessation services, such as the California Smokers Helpline. At Lake County Tribal Health, they are implementing an Ask, Advise, Refer protocol during patient visits to refer people to the California Smokers Helpline and or to their own tribal cessation services. At United Indian Health Services, we have Wendy, who is working with the Ask, Advise, Refer protocol during patient-client visits, who are referring pregnant women who smoke to the California Smokers Helpline. And then with Tuolumne, Band of Miwok Indians, we are working on getting 100% of the tribal-owned health and dental clinics to adopt and maintain tobacco-free campus policies, and maintaining a system to routinely ask and assess patients for tobacco use, also referring them to the California Smokers Helpline. And then with the Yurok tribe, we're focusing on developing social media that is referring community partners to the California Smokers Helpline as well, while also sharing the effects of secondhand smoke and the harms of commercial tobacco use on their community. Let's see. Perfect. I zoomed right through that. Okay. And the best way that I want to highlight what we have been working on with our tribal partners is to bring them in and have them talk about maybe some of their journey on adapting their project's policies, adoption and implementation, what they're working on, what's working, what's not working, and just give an overall assessment of the work that they've been doing. So today we have Wendy Wrinkle, who's been the supervisor for a Native Tobacco Project for the past 3 years. She's been with the tribal initiative since the direct funding has been put out, and has also worked in tribal health for the last 11 years. So Wendy, I'm gonna allow you to share your screen and pass it over to you. All right, there we go.
Good afternoon, everybody. Thank you for that great introduction. My name is Wendy Wrinkle. I'm the project supervisor for the Native Tobacco Grant. Trying to share my screen right now. Let's see. Oops. There we go. Hold on one second. Can everyone see my screen? Okay.
Yes,
So
we
like
can.
yeah, okay. So on one second. So yeah, I wanted to share about some of our tobacco cessation activities. And my name, like I said, is Wendy Wrinkle, and I oversee the Native Tobacco Project. And Native is an acronym for Native American Taking Initiative on Values. And this project works with Humboldt and Del Norte County American Indian and Alaskan Native community members, tribal members, and tribal councils to reduce illness and premature death related to commercial tobacco use. And here we have two of our coalitions that are very involved within our project. CORE was established in 1992, and their mission is to create a healthy and productive American Indian community. And this is a grassroots volunteer community coalition and works to build a healthier community by encouraging and supporting lifestyles that promote spiritual, physical, mental well-being. CORE provides direct feedback towards our health promotion education programs housed within the Tribal Public Health Division. Our younger coalition is called TAG for Teen Advisory Group. And this is a peer-to-peer education program for young adults ages 12 to 17. Many topics are covered in TAG, but all teachings have an emphasis on tradition and culture. And so these are our two coalition groups. Here we have some trainings that we offer to the community, our CORE coalition and TAG coalition, and a new component this year within our trainings is to bring speakers who have knowledge on traditional tobacco. During COVID, we were unable to bring our two coalitions together, but now we are planning a special training. In the middle here, you'll see a flyer that's going to be for one of our trainings that's happening at Fern Canyon towards the end of the month on June 23rd. So we're looking to really come together and share what we've learned over the last 3 years. To the left, we have some other past trainings that I included as kind of our outreach of how we're engaging community members. One of our special trainings we did was a storytelling training with our TAG and CORE members. Our project worked with youth, elders, and pregnant clients to create tobacco prevention stories that have developed tobacco prevention stories using prevention-based words and words of respect for the culture and traditions regarding traditional tobacco to encourage youth to not use commercial tobacco. And now we are actually implementing some of our stories into our other activities such as outreach and social media. And so I'll be sharing about that also. Another big success for our project is developing our culturally appropriate posters. We use local community members in our posters and create messages that will resonate with our community. And so these are disseminated to all UIHS clinic sites, tribal governments, and providers servicing our pregnant moms. We've also gotten requests from WIC, Head Starts, and public health departments to utilize these posters in their offices. These posters are also available on our UIHS website, and we also share them on social media. Our posters were written into our scope of work primarily to share resources in more rural populations and utilizing local community members. When community members see these posters and know the baby or mama, I had a client come in and say, "That's my great grandbaby." And so she requested some posters. Of course, we gave them to her framed. And so she was extremely happy. And so we also give these out during our outreaches in a smaller format. So we have designed special quick kits that are specific for our pregnant American Indian, Alaska Native women and also our UIHS clients. As you can see, we have beading materials, we have a journal and pen, different brochures, education, some seeds and suckers, and we also have an acorn stress ball. And all of these quick kits are available at all of our clinic sites and available upon request to anybody. You do not have to be a client to receive one. And so we, like I said, we incorporate our coalition with many of our activities, our educational outreach. We have one here on the left, we have two of our elders that were tabling and really providing great education for clients coming into our clinics. And then on the right, we have some of our TAG members at our Hawk Walk that happened last August, and just really sharing information that they learned through our project for community members. Another great activity we have is our tribal council presentations. And we feel like we have a really great strategy where we incorporate our core and TAG members to co-present with our project during these policy meetings. And so they share knowledge that's greatly appreciated by our tribal council members. Recently, here's a picture with Susie. She had smoked for over 40 years, and she just celebrated 5 years of being smoke-free with two of our specialists on the project, Mike Sanchez to the left and Lydia Adams to the right. And so we also encourage our coalition members to share their tobacco stories that were created. Some of the challenges that we did encounter during COVID were other matters were a lot more pressing for our local tribal councils. And so it was hard to get on the agenda, but we are a very persistent project. And so now we are presenting on a regular basis. Another challenge was communication after the presentation. So during the presentation, they're like really applauding us and, you know, say they want to work with us, but then getting over that hump where we're connecting and finalizing the ordinance can be rather difficult. So we're working on different strategies to overcome those barriers. Another workshop that is happening, we have a commercial tobacco workshop, and these are for our clients breastfeeding, parenting groups, and focuses on such commercial tobacco, secondhand smoke, health effects for children, traditional tobacco, and cessation resources. And so these workshops are being offered in person and online. Recently, our project did a workshop and included a social media development component at a tribal opioid summit. And this was an interactive workshop in Humboldt County. Participants were able to create their own social media content that we posted. And then here we have some of our social media posts. We try to keep it simple. We have our project name, our logo, and then short education. And then a lot of times we'll put a link on the top of the post. And so project staff have identified various local Facebook groups through our tribal communities that we will share these to create more engagement. And then we're also utilizing the boosting function, which can be problematic at times, but we seem to be doing a little bit better now. and wanting to increase that engagement and share our resources. And then here we have some billboards that have been created over the last 2 years. During COVID, of course, a lot of us were not traveling, and so we were able to move those funds. So this wasn't originally in our scope of work, but we have the one down here on the left was centered around our pregnant clients. And then the last one that is currently up right now in Crescent City is focused more around youth and encouraging people to not use commercial tobacco. That's it for me. If you'd like to get a hold of me, my contact information is down below. And I thank you for allowing me to speak today.
Thank you, Wendy. That was wonderful. I just love the examples, of course, of all the media that you guys put out and how it's so culturally appropriate and catered exactly to the community, increasing community engagement. I appreciate that so much. So let me, in the interest of time, I'm going to jump back on here and introduce Alex, who will give us our next presentation. Alex is the program coordinator from the Lake County Tribal Health and also a member of the Cloverdale Rancheria, and has been working with Lake County Tribal Health for about the last 1.5 years, still considers to be a newbie, but he's leading this project with such awesomeness. So let me hand it over to Alex. You can share your screen. Thank you.
Hello everybody. Yeah, thank you for being here. So I'm with Lake County Tribal Health, and so here at the clinic we work with more focused with the medical and dental teams here. And recently we opened up our South Shore location that's about 30 miles away from our main clinic. But so last year, we created a medical standard operating procedure with our medical team. And then, it goes through the purpose, responsibilities of, so this is for the nurses and the providers here at the clinic within the medical clinic. And so you can see there's the purpose, and then to implement the ask, advise, refer protocol during patient visits. And then the responsibilities, enforcement, and procedures. And then we added the definitions, acronyms, and attachments. So this is something that we worked with the nurse manager and chief medical officer here at the clinic to create this for all medical staff. And next, this is our medical flow map. So you can see where the patient first gets to the clinic, patient arrives, the nurse completes the GIPRA questions, sees if the patient uses nicotine, vape, chew, tobacco. Nurse will ask the questions, and if then the provider is informed if the patient uses nicotine or not, and you'll see if no, provider will note that and note to follow up at next appointment, enters it. If yes, provider will review the readiness of the patient and determine if they're ready or not. And if they're not, then the provider will do a motivational interviewing and relay information, health information to the patient. If they're not interested in quitting at that time. If they are, the provider will refer them either to us here at the clinic, to our tobacco cessation program specialists. And then the provider will send referral to the tobacco health specialist. And then our specialist will talk with the patient about our tobacco cessation workshops, do assessment, create a plan for the patient to quit. And then here's our dental flow map. So you can see similar where the patient will arrive, patient arrives. And then they meet with the hygienist or the dentist, and then the dentist will, you know, if they determine that the patient uses nicotine, they'll determine their stages of readiness to quit. And if they are, then the patient provider will refer the patients to us here at the clinic in our tobacco program. And then here you can see our stages of referral process. So stage 1, new referrals received. Stage 2, patient is called within 3 business days to see if they're interested. Stage 3, an assessment is done to determine tobacco type. Stage 4, patients are offered individualized sessions to help prepare them to quit. We also offer tobacco cessation workshops throughout the year. And that's it's starting in last September 2022, we started offering in-person tobacco cessations. So far, since August of 2021, from referrals that we went back to, we had 209 medical, dental 310, other departments like behavioral health, physical therapists, human services, 7 referrals, and then also self-referred. You can see 12 of them. Our adult tobacco sensations, we follow the Second Wind curriculum, which is culturally relevant for our American Indian, Alaskan Native community adult participants. To date, we have had 11 tobacco cessation workshops, 8 over Zoom, and there are 3 in person, each at our main clinic, 1 at our South Shore clinic, and 1 on our Robinson Rancheria. And participants, the participation rate ranges between 2 to 7 participants each time. We have our tobacco cessation services for youth, which we follow the Project Sunset, stop the use of nicotine, start engaging traditions for our American Indian, Alaskan Native youth. We're working with our schools, middle schools and high school during the Native American Youth Club, and offering services during that time at lunch. We provide lunch and good stuff like that. And so far we had 3 youth cessation workshops completed since September of 2022. We'll be starting our next tobacco youth cessation with our Big Valley Rancheria this week, tomorrow. Next, what are some challenges and barriers to adapting, implementing our policy? Last July, we implemented our new EHR system, Next Gen. It's been a work in progress. Staff turnover in the medical department, providing training and technical assistance specifically to our medical team, because there's about 50 of them and it can be crowded. So it's just trying to be how it can be more efficient when we're doing training and technical assistance for our medical team. Increasing our tobacco cessation workshop participants, providing services for all 6 local tribes here in Lake County. And with the new EHR system, it's not linked up to Kick It California. So if providers want to refer patients, they have to do it manually. So going to the website, to Kick It California website, and doing it that way. Or our health specialists will refer them manually. What are some creative strategies that our project has found to adapt for our referral process? So here on your left, we have our Are You Ready to Quit questionnaire. There's about 4 questions. I'm sorry you can't really see it. But if they answer yes to any of the one, then the providers would prefer them to our health specialists If not, they keep this sheet. This is a two-sided sheet. There's information on both sides. If they're ever interested in, contacting us, here's our information. More recently, we worked with tech on these two posters, and these two posters will be going up in our both clinics inside the medical exam rooms to hopefully boost awareness of our services here at the clinic. And these are some of the lessons that were learned. Need for a champion within the medical, dental, and other areas within the department. One good champion is our pharmacy. She's really good about sending patients to our health specialist before doing a prescription for NRTs. She's really a big advocate for our program. Need for continuous quality assurance. We try to do monthly medical and dental in-services, understand the patient's readiness, priority of respect for patients' beliefs and traditions, and continue to check in with patients' tobacco use, readiness to quit. The continuous collaboration with medical and dental is key. More recently, we've been going to the community and seeing if there's a need for us to offer tobacco cessation within their community, and asking the community what they want and their needs are. And lastly, what advice would I give to non-tribal projects that are looking for a way to work with tribal projects? Here's a couple: respecting traditions, ceremonial tobacco, respect the culture, come with reasoning, be patient. Just a few, and that's it. Thank you.
Thank you, Alex. That was wonderful. I love just that, we have an amazing example of the advisory fur being used in a tribal IHS clinic, and that it's been so successful in the medical side that they implemented it also in the dental. And along with all of that, it's just leading the path, but also learning all the hard lessons that come along with it. I appreciate that so much. Let's see, I'm just gonna share my screen. Thank you all for joining us. Man, those 30 minutes went by so quickly. I just want to also point out that although our policy platform highlights our 4 priority areas, we do have tribal partners who are working on multiple policy implementation in the communities. And this is our full list of what the tribal projects are working on. And we can share this as a resource to send out to everybody who registered for the webinar. Thank you so much. Let's see. There's a question in the chat. No questions? Okay. Sounds wonderful. Thank you so much.